The Kent Center's Youth and Family Program consists of master's level clinicians, case managers, and a psychiatrist who provide comprehensive home and community-based services for children and their families. Children in our home and community-based programs receive supports within the home or in the community to assist the child and the family in addressing the emotional, behavioral, environmental, and familial issues that are impacting the child and the family. The family and child receive an initial, comprehensive biopsychosocial assessment to determine an appropriate plan of care. This plan of care may include individual, family, or group counseling, parenting skills education and training, education on symptom and behavior management, medication evaluation and management if necessary, and coordination of care with other providers and agencies involved in the family's care. With the family's permission, the treatment team provides the child or adolescent's pediatrician or other primary care provider with important information regarding diagnosis, medication, and treatment recommendations. There are several eligibility criteria for home and community-based services for children and their families. The child must be between the ages of birth and 21 years old and be covered by any of the following health plans: Medicaid or a Right Care plan, or a commercial health plan such as Blue Cross and Blue Shield of Rhode Island or United Health. The child and family must also meet one or more of the following criteria. The child is struggling with moderate to severe psychiatric symptoms, and traditional office-based counseling has not been sufficient to manage these symptoms. The child is at risk for requiring psychiatric hospitalization because of uncontrolled mental health symptoms, or the child is being discharged from a psychiatric hospital or residential setting and is in need of intensive supports to successfully transition to the home or community. The child is at risk for an out-of-home placement, or the child and family are experiencing a behavioral health-related crisis that does not warrant a psychiatric or other type of hospital admission. For these families, intensive home and community-based services may be successful in alleviating the crisis and preventing the need for an admission. To make a referral to our Youth and Family Home and Community-Based Services program, simply call the Kent Center's Intake Department at 401-732-5656. The first visit will be a comprehensive assessment with a clinician who will determine if the child is eligible for the program. The child and family will complete paperwork, discuss the current issues in depth, and provide current and historical information about the child and family. The child and family will be given a follow-up appointment with the clinician who will be working with them. Clients should bring their insurance card to the first visit, a list of current medications, and the names, phone numbers, and addresses of other doctors or agencies involved with the child and family. For families with Blue Cross and Blue Shield of Rhode Island, or with United Health Insurance, not a Right Care product or managed Medicaid plan, there may be a cost associated with the services. Therefore, families should check with their insurance company regarding co-payments and deductibles for these services. Families should be prepared to pay the full amount owed at the time of service. The Kent Center accepts cash, credit cards, checks, and money orders. The Kent Center's Youth and Family Program also offers traditional outpatient office-based services to assist children and families struggling with mental health and substance abuse issues. Our program offers individual, group, and family counseling. Counseling, whether it is individual, family, or group-based, offers clients the opportunity to process the emotions, symptoms, and situations that detract from their emotional well-being. Counseling affords the opportunity to identify and transform the negative thoughts, feelings, behaviors, and situations that are impacting children and their families, and to build the skills and resilience to manage these issues effectively. The outpatient program also provides short-term medication management and evaluation for children or adolescents who may be in need of medication to manage their symptoms. Outpatient counseling is typically covered by the child's insurance or health plan. However, if the family does not have insurance, there may be ways to provide services to the family. The intake department at the Kent Center would be helpful in facilitating access to services in this situation. To make a referral to the Youth and Family Outpatient Program, simply call the Kent Center's intake department at 401-732-5656. The first visit will be a comprehensive assessment with a clinician who will determine if the child is eligible for the program. The child and family will complete paperwork, discuss the issues in depth, and provide current and historical information about the child and family. The child and family will be given a follow-up appointment with the clinician who will be working with the child. Families should bring an insurance card to the first visit, a list of current medications, and the names, phone numbers, and addresses of other doctors or agencies involved with the child and family. There may be a cost associated with the services, and families should be prepared to pay the full amount owed at the time of service. Families should check with their insurance company regarding co-payments and deductibles for these services. The Kent Center accepts cash, credit cards, checks, and money orders. The Kent Center's Eleanor Briggs School provides comprehensive K-12 academic services, pre-vocational services, and diagnostic and clinical special education services to students with emotional and behavioral disorders and/or learning disabilities. To be eligible to attend the Briggs School, students must be identified by their respective public school system as someone whose emotional and behavioral needs exceed the scope of services and supports that are available within the school system. All referrals to the Briggs School must be generated by the student's respective school system. The family or referring agency should speak with the school system's special education director to discuss a potential referral. Briggs staff will work with the child and family to complete a comprehensive assessment of the child's needs in order to develop an individualized education plan or IEP. Services are funded by the child's respective school system. The Macy Quinn program is a collaborative alternative learning program providing special education academics and behavioral and emotional support services to West Warwick students in grades 9 through 12. Eligible students are identified by the West Warwick School Department as having emotional and/or behavioral needs that exceed the scope of services and supports available within the school system. All referrals must be generated by the West Warwick School System. Families should speak with the Special Education Department of the West Warwick School System if they believe this program would benefit their child. Macy Quinn staff will work with the child and family to complete a comprehensive assessment of the child's needs in order to develop an individualized education plan. Macy Quinn services are provided at no cost to the student or family and are funded by the West Warwick School System.